Hello everyone, and thank you for checking out this podcast. It is a pleasure to be here and have the opportunity to talk about the BeWell project aiming to shape the health and care workforce of tomorrow, together with George Valiotis and Zoe Milona from the European Health Management Association, Ronald Battenburg from NIBEL, and Michele Calabro from Eurega. Hi Zoe, can you tell us more about the recently released first version of the BeWell skill strategy?
So it's really a pleasure to be managing this amazing project, which is not a project anymore. It's a movement. It's a strategy from and for the health and care workforce. So ultimately, we want the skill strategy to be implemented at the local, regional, national, and European level. And we will be doing that by using the Pact for Skills and the Large Scale Partnership of the Health Ecosystem, which Emma, in collaboration with Eureka, coordinates. To make sure that the voices of everybody are depicted into the skill strategy. And most importantly, make sure that the health and care professionals are really represented in what is supposed to be implemented for them and in a sense by them. This is why the skill strategy is so important. It's a monumental work right now in Europe. It has never been done in such a large scale before. And as Emma, we are very proud to be coordinators of this project that have such amazing partners from a multi-stakeholder representation and for so many European countries. We have 24 partners and 5 associated partners that represent the VET, the higher education, the labor market, the health and care professionals. And we could not be prouder for launching the strategy at the ELA conference this year in Rome, and having a 3-year consultation ahead of us.
Thank you, Zoe. Ronald, can you tell us more about the skills intelligence developed by the BeWell project?
Well, it's a pleasure also from my side. As NIBEL, we are one of the partners in the BeWell project, also responsible for, let's say, the skills intelligence, which is the base of the project. Because there's so many information, knowledge and research out there on digital skills, on green skills. So the first thing to do is to structure the information and make it available and make it useful for acting and providing training material and training opportunities and opportunities for the health workforce professionals. And they should meet their needs, because we all know that the workforce is under pressure. And so what do we need to offer, and how can we tailor digital skills and green skills in training for different types of professionals in different settings, taking into account that in addition, managers and policymakers also play an important role in skills development for the professionals and for their own jobs. So that is the challenge we are facing right now. And we had a great opportunity here at the ELA conference to present the first demo of the Skills Monitor, which provides this information exactly tailor-made. So users can click on what type of information, what type of training, for which type of profession, for which country they need, and their results pop up and they can further work with this. And we cannot do this alone, you know. There are many organizations on the European, global, and national level that already are developing training. So we want to build upon this and leverage this in this Skills Monitor. And so I will invite you to go to the Skills Monitor and experiences that and give us feedback on this. Thanks.
Thank you, Ronald. So, George, what are the next steps for the BeWell project?
It's important that everybody gets involved. We want the large-scale partnership to be accessible to everybody. You've heard that this is about being by and for the healthcare workforce. But in order for that to be successful within the context and the societal changes that we're living in, we need everybody to be able to inform it, to add their part. We want policymakers to be able to implement the changes that we suggest. And so therefore, we need everybody fitting into this strategy. You can sign up for the large-scale partnership to commit to supporting the work that's happening. You can also fill in the online surveys and be part of the consultation processes that builds on version 1 to make sure that it understands the full complexity of the healthcare system. And we can ultimately produce a final strategy in 2026 that brings everybody's needs together and provides a blueprint for a way forward that addresses the learning and care needs of the healthcare workforce, that addresses green and digital skills and all the other contexts that we need to make sure our healthcare workforce have what they need to thrive, and that therefore our citizens can receive the best possible care that they need both today and in the future.
Thank you, George. So, Michele, what are the benefits for the organizations that will register in the Path for Skills Large Scale Partnership for the health ecosystem?
So the partnership is indeed open to everybody that it's working in the field of skills. So the benefits goes from, of course, being able to share what you're doing in the field of skills, in particular digital and green. So to share what you're doing, to share your commitment, to share your courses, and so on. At the same time, in this way, you'll be able to engage with other peers that are working as well in the field, and of course also to provide inputs to the strategic dimension of the work of BeWell. For instance, again, the skills strategy or other elements, a skills monitor, and mapping of skills across Europe.
Great. Thank you, Michele, and thank you all for this interesting chat. Dear listeners, thank you for joining us. Follow BeWell Project on LinkedIn and Twitter, and stay updated with all the news from the project shaping the health and care workforce of tomorrow.